Good morning, everybody. So I had a lot of questions the last couple of weeks around staff training in schools. And I think from what I'm grasping, there seems to be a little bit of a, can we just have a recap on how do we focus our attention on the training that's happening in schools and making sure that it's relevant, making sure that the right staff are getting the right level of training. And so really, I wanted to just address that with you today. Some of you will be familiar with the slide that I'm going to share with you because some of you have already done your senior mental health leadership training with us. And some of you may very well not have done your training with us, so you won't have seen this slide before. But this slide very much answers this question. So I just wanted to share this with you today. So first and foremost, before you start looking at this kind of triad that I'm going to talk you through in a second, the first thing that you should be doing, if this is on your kind of to-do list or as part of your action plan, is to do an audit. You need to audit what staff have done what training first and foremost, so you know who's done what. Once you've done that, there needs to be a record of this kept somewhere. So you should have a record of who has done what training, to what level, and when. And that's really important because training runs out, some training has to be renewed. It's helpful that if you did your mental health first aid training 4 years ago, that actually you go back and you do it again now because it's been 4 years. So it's really important that you have the ability to know who's done what and when, and also review, okay, so that you haven't done that training now for 4 years, that's something that needs to be looked at. It's also worth being particularly mindful that there are essential training that has to be done in schools, things like safeguarding training and stuff like that. So make sure that all of those essentials and those must-haves are there and done as well. In terms of kind of CPD and any other training, the way I try to look at it is in this triad approach. So on my screen here, you can see the triangle, and at the bottom, what we're looking at is awareness and signposting. So this is really for all staff. And when I say all staff, I really do mean all staff. Please don't forget the likes of your reception and your admin staff, your catering staff, your cleaning staff. Everybody in your whole school community should have some training around awareness and signposting. It's also helpful to extend that out, making sure that your pupils have an awareness of this as well, making sure that your parents and your carers have an awareness of this as well. But let's try and keep it focused on staff for the context of what we're looking at today. So awareness and signposting is all staff, and that's the reason why it's at the bottom. It's the biggest part of our triangle and our triad. Once you have become aware, okay, everybody's added awareness and signposting. This is when we did it. So now I know when it's got to be renewed. It's on my system that I'm tracking all of this information on. We're moving up into then thinking about early interventions. So any low-level intervention that's happening in school, things like SALT therapy, things like drawing and talking, things like anxiety program-based interventions, any low-level intervention that's being delivered perhaps and usually by your pastoral staff or anybody within that pastoral department, that would fall under those early interventions. So there's going to be some staff, hopefully, you know, not one or two, because that's going to be at the top of the triad. There's going to be a handful of staff that are going to be able to deliver these early interventions in schools. And there's a reason why that's really important, and I'll come on to it shortly in a second. After that, what you're then looking for is this specialist training. Now, there's normally a little bit of confusion here. So specialist training and specialist input, people assume, well, that must be outsourced then because we in schools aren't clinicians and we're not counsellors and we're not CAMs. To an extent, that is correct. There will always be an element of some specialist training needing to be outsourced to the likes of CAMs or your educational psychologists and people like that, and that is okay. But for the context of what we're looking at today, we're looking at specialist training for your staff. So this means internally. And I'll talk about again in a second, like I said, why that's really important. So specialist training within your school and within your staff can be selecting those, you know, couple of members of staff who are able to upskill themselves to a more specialist level, i.e. they can go ahead and do their counselling, they may go ahead and do some CBT training, they may go ahead and do some kind of clinical training. That really allows you to start to make your strategy really sustainable. If you're constantly outsourcing your specialist training or you're outsourcing any early intervention, your strategy in your school isn't going to be sustainable, and you're not going to get the maximum impact for your staff, your children, and your homeschool community, because you're going to be limited by timescales. You're going to be limited by thresholds, particularly. So for children who don't meet threshold, there needs to be interim support. And what I mean by that is some children don't meet the threshold for a referral into CAMHS, or the referral's made and then it's pushed back from CAMHS back to school. What needs to happen is that there is a level of ability by schools to develop these early interventions and make sure that these things are happening, low-level interventions, and that you've got a very handful of members of staff that are able to deliver some specialist training and intervention for the children that you're working with as well. In doing so, we'll ensure that you are able to bridge that gap between schools and external services for either threshold reasons, as we've just discussed, but also for reasons of time. So a referral into CAMHS, or a referral for an education, health and care plan, for example, the referral itself can take an awful long time. That is a child that is just sitting in the system now waiting, not accessing any level of support. If you then add that time to the time that it takes for a referral to be processed, for the child to then be seen, it can be over 12 months, 12 to 18 months in some boroughs, especially for the likes of CAMHS at the moment. Again, that is a child that is still waiting to be seen. That is a child that is still needing to access support. If you have access to early interventions, low-level interventions in your school, then you have interim support in place for that child. Or sometimes it can be a case of actually we don't need to make a referral, because we can actually work with the child internally, and let's see how that goes first and foremost. Same with your specialist training and your interventions. If you are able to deliver that internally, then you are able to have interim support in place for children who are on waiting lists, who haven't been seen yet. That then allows you to, when they do get seen by CAMHS, for example, to liaise with CAMHS and say, okay, this is what you're doing, this is what we're doing, let's work together. All of those things can start to happen, and suddenly then your strategy is sustainable, it's impactful, and that's what's really, really important. So have a think about that, go away, have a think about what's currently already been done in your school. Start, as I say, with this auditing, making sure you're aware of who's had what training already at this point. Start with reviewing. So you did your training 3 years ago, let's get you back up and get you a top-up training, if you like, or a refresher course. And then really start to think about this triad and how you can incorporate that into a level of your CPD training and what you're doing for your staff. As always, any questions, please give us a shout. Otherwise, have a great weekend when it finally arrives for you all, and I will see you all on Monday.